Okay, while everybody's taking their seats, let me start to introduce our next speaker, Dr. Wilbur Smith. He's an experienced medical educator who has been a professor and chairman of the Department of Radiology at Wayne State University for the last 13 years. His clinical areas of interest include pediatric radiology, brain trauma, child abuse, and medical education. He has published approximately 420 peer-reviewed articles, multiple book chapters and reviews, and manuscripts for several major publications. For the last 4 years, Dr. Smith has also held the position of Designated Institutional Officer at St. Joseph Mercy, Oakland, and as Director of the Graduate Medical Education Office at the institution, where he also oversees the Institutional Review Board and the Continuing Medical Education Divisions. So please join me in giving him a warm welcome today.
All right, I don't know who that Smith guy is, but it's not me. It must be my kids. Anyhow, we're going to have fun now. And we're going to do it in a researchy way. But the best way to get yourself up front here doing the presentation is not to participate in the discussion. So we have a panel of people who are going to help the discussers. And they're going to select the person who most tries to hide or be silent to be the one who does the oral presentation. So everybody participate, okay? Unless you want to do the presentation. If you want to do that, that'll be fun too. Okay, so research, I stand in awe. You know, I'm scared being here because I'm not really a very good researcher. I'm from the era when you get by with descriptive research and things like that. And some of the things like when Karen talks about power, it scares me to death. Now, power is actually fairly easy once you decide what effect size you want. There are certain just rules you can lay out, but otherwise there's that awful alpha that only statisticians know and understand. So research, what are the pillars of research? Quantifiable. Remember, we talk a lot about numbers. Now, there is very valid observational research. It's a field called astronomy. If you didn't think about it, if we didn't have observable or observation-based things, we wouldn't have any astronomy. We wouldn't know where Pluto was or whether it's a planet or not. So the observational research is valid. It can be valuable. Everything you think of starts often with a case report in medicine. Somebody sees something, says, I haven't seen it before, puts it together, and wham, you've got a contribution to science. But it's not quantifiable. And now, when we take it the next step, we've got to get to quantifiable. It has to be confirmable. For years, I did studies of nipple sucking. Now, that would sound crazy to you, but it turns out there's bazillions of dollars in how to design nipples because everybody wants their baby's nipple to look like the real mom's nipple. And so I could do it, did it with ultrasound, but making it reproducible was extremely difficult, and training people to do it reproducibly. And until we developed a technique so that anybody, any one of you out there could pick up a transducer and reproduce what I did, wasn't worth anything. Must be reproducible. There's the key word. There's a rule called Smith's rule, all right? This is the second most important rule in research, okay? And that is truth, whatever truth is a fraction which has a constant, and the constant is called common sense, and that constant is divided by the number of articles in literature. Think about it. Why is that true? If you think about everything that we don't know, or can't precisely answer. There's a billion articles trying to figure out how to do it. If you got the right answer, there's an article to confirm, 2 articles to confirm, 3 articles to confirm, and that's it. So Smith's rule, truth equals a constant divided by the number of articles in the literature. More articles there are in the literature arguing about something, the less we know about the truth. And then finally, it must be defensible. There must be an intelligent, objective way you can defend your work. So, and Karen talked about this much more elegantly, but if you're going to do research, the first thing you got to do is write out a hypothesis. If you don't write out a hypothesis, you're going to find yourself chasing your tail all over the place. So you need to know in a formal statement what represents the expected relationship between your variables. And null hypothesis Karen talked about, and she's much smarter than I, so I won't even bother you with that. So when you plan your research, you want to do, in many cases, an hourglass approach. You know what an hourglass is, right? Everybody knows what an hourglass is? Okay, good. So begin with a broad concept of relationships, narrow it to specific questions about the relationships. That's what Karen was talking about when all your mentors will have kind of a broad relationship, broad idea. You pick the little pieces of it and figure that out. So you are the best expert in the world on a little piece of it. Then you form a testable hypothesis on that little piece. You got it right, you got it wrong, you know, something that you can handle in the time you have to work on. Manipulate the variables, analyze the data, reach the conclusions, and then mushroom out. I have shown this is related to this, therefore this relationship may be more universal, widespread, useful. My first, I shouldn't tell you about this. Yeah, I'll tell you about it anyway. My first experience as a faculty member, I thought I was pretty good. You know, I'd finished a fellowship, I'd finished a residency, 2 residencies actually. I wasn't smart enough to settle on the right thing the first time. I finished 2 residencies, and I joined the faculty at Indiana University, and I thought, boy, you know, I really know what I'm doing. And about 6 weeks into my time on the faculty, the most distinguished professor of radiology at that time called me up on the phone. I was honored. You know, here's the famous Roscoe calling me on the phone. And he said, "Smith, you're never going to be worth a shit," and then hung up. Well, that was a little bit taken aback, you know. So I figured, what the heck's this guy telling me? So I did what Karen told you to do and a previous speaker. Go to the library and read his CV and find out what the hell he's talking about. I did. And Roscoe was the world's expert at picking little tiny corners of a big question, becoming the biggest expert in the world on them, and writing them up. So I called him up and I said, "Roscoe, do you mean even though I published 13 papers as a resident and all, I'm too diffuse, I don't follow up?" He said, "You got it," hung up again. Well, you know, we're much nicer nowadays. We won't ever introduce your career that way, but that was a very valuable lesson. He was right. So research hourglass. Pick little pieces. Don't try to eat the whole elephant. Eat pieces of the elephant. Null hypothesis we talked about already. Type 1 error, type 2 you went over, right, Karen? Okay. What's a type 2 error? Rightly or wrongly rejecting the null hypothesis? Well, the answer's there, right? So if you never want to miss anything, what do? Let's say you never want to miss, you never want to have anybody on rounds say to you, why didn't you test for serum porcelain? What do? Test for serum porcelain on everybody. Nobody will ever blame you for that, right? Now that's the old thinking. What were we taught in medical school? How many of you ever got yelled at for not doing a test on a patient or evaluating some parameter or not doing a CT during your training? The honest people are putting their hands up, the dishonest people are not putting their hands up, and they're going to have to give testimony later because I can tell they're not participating. Everybody did. That's traditional medical school thinking. Now we teach over-testing can be dangerous too. You know, false over-testing is going to relate in false positives or end up in false positives. Those cost money, those cost lives. Anybody know who Johnny Bench was? Who was Johnny Bench? What a bunch of, all the old people in this row. Alan, who was Johnny Bench? What? Oh, no. Johnny Bench is a Hall of Fame catcher for the Cincinnati Reds. Dr. Silverglide went to Cincinnati, as did I, for part of his training. Cincinnati Reds, Hall of Fame catcher. Cincinnati is in the Ohio River Valley. What fungus lives in the Ohio River Valley and everybody gets? Histoplasmosis. Somebody said that right up there. Good. He was also the honest one who put his hand up about getting blamed for type 2 errors. But anyway, histoplasmosis. All the Cincinnati Reds decided that all their players needed a physical. Why? Because it cost them money if they got bad players and they got injured, right? So they did the physicals on them. And part of the physical was a chest x-ray. What does histoplasmosis give you in your chest? Nodules, right? I have histonodules in my chest from Cincinnati. Alan has them, I'll bet you a nickel. And you can't be there without getting the damn things. Well, what happened? They found a nodule. You find a nodule, it's over 4 millimeters. Malignancy, right? 28-year-old active baseball player, Hall of Fame catcher. What did they do? We can't miss a cancer. They operated. Overcalls cost money, but they also cost careers. When they operated, they sliced the latissimus dorsi, and Johnny Bench couldn't throw to second base anymore. All of a sudden, here's a bazillion-dollar catcher in the Hall of Fame whose career is hampered by an overcall. So type 1 errors aren't too good either. Okay, power. Power is the ability to reject the null hypothesis. Karen gave you the 4 elements of power. Being a very simple person, I'll tell you how I do it. And that is that all I need to know is what the effect size is. How do you know what the effect size you expect is? Look at the literature or make a wild guess, either way. Then you need to know what degree of proof you need to accept. What degree of proof do we accept in medicine before we say a study is relevant? P less than 0.5, right? What does that mean? There's a 5% chance you're wrong, right? And a 95% chance you're right. Could you cheat? Could you say, I'm going to take a P less than 0.2? Sure. That will affect your power too. So what you pick, P for us, the less than 0.5, that's easy, that's standard. So then your sample size and your effect size. If you expect a big effect, you don't need many patients. Now that's an answer to your question on power. Now alpha is that thing that statisticians figure out. So they'll give you a more precise answer, but you can pretty much figure it out very easily if you have a pretty good idea what your effect size is. So anyway, there it is. The people don't know their own. I think that might be the orange-haired monster on the other end, but I don't know for sure. You got it. Okay, good. All right, so we're going to skip past all this stuff because you know all that anyway. There are a lot of definitions of variables, and this is the simplest definition in the world. An independent variable is something you can't do anything about. So I am a male. I am probably not going to become a female. It's possible, but I still won't be a real female. I'll still won't have the double X. That's an independent variable. I am 75 years old. Now next year I'll be 76, God willing, but you know, that's what it is. So if you want a population of people who are 75 years old, I'll do it for you, for your study, okay? Those are independent variables. Dependent variables are things you vary about that. You say, does drug A make 75-year-olds less grouchy? Okay, that would be an important thing. You ask my wife. But anyway, that's independent, dependent. Where you get really tripped up are moderating variables, which means that your group is not right, that somebody in your group has more expertise or is substantially different than the rest of the group, and therefore they weight the group. And then intervening variables, and those are the ones that really kill you, because that means somebody changed the rules. So for example, one of our residents did a great study of it was some breast cancer group anyway. And what they did is the breast cancer group changed the national standard right in the middle of her study. She geared it to a level of X, and all of a sudden they said, nope, level of Y. That dooms you. You can't get around that. Okay, classical research, limit your variables. Karen went over all this better than I did. Okay, so what we're going to do now is we're going to take the broad concept. We're going to be at the top of the hourglass, all right? And we are going to design foods. And I decided that we would design a food that everybody pretty much knows, and that McDonald's has offered $1 million for the best design for this food. And so we're going to design how to make peanut butter and jelly sandwiches. Now you will think this is simple. However, what we're going to do is we're going to follow the Roscoe's rule, and we're going to break this into pieces. So we will not hit the global, we're going to hit the pieces, and then the pieces are going to come together for the answer in the end. So we're going to go in 4 groups. We're going to go the last 5 rows, be group 1, next on this side, group 2, that side, last 4 rows, because they're cheating, they're sitting in the back, will be group 3, and everybody up here will be group 4. And we're going to organize our project in 4 pieces, okay? So piece number 1, as you think of peanut butter and jelly sandwiches, is going to be peanut butter, right? We happen to have a world expert on peanut butter here to help lead the discussion. And so we have peanut butter expert. Part 2 is going to be bread. There are, depending on what you count, well, it depends on how you count it, but there are over 200 kinds of bread. So it so happens that Dr. Haglund is an expert on bread, and she is going to be the bread person. We have 2 lovely people here who know everything in the world about jelly, and they will be the jelly people. I stopped at a place in Cincinnati, god awful, called the Jungle Gyms. It's like a warehouse, but it's like 5 warehouses full of food from every country. I don't know how they maintain their stock. So I happened to count the number of different jellies they had. They were over 250 different jellies on shelves. It was awful, horrible. And then finally, because I have a son who happens to be a gourmet chef, he has taught me that presentation of food is everything. So group 4 down here is going to do presentation. Group 3 up there is going to do jelly. Group 2 is the bread group. And group 1 is the peanut butter group, all right? Now, I want you all to get so you can talk, and we're going to talk about, I want you to identify the independent variables. You know, are you designing for kids, for example, as opposed to 75-year-olds? The 1 or 2 independent variables. Are you designing for women? Do women have better taste than men? They do. Women also have better smell. Women they generally smell better than men, but they also can smell more shades of difference than men. So that's probably why they have longer noses. But anyway, we're going to do the presentation. How do we cut our bread? How do we do it? And we're going to do this for 10 minutes. I want independent variables, dependent variables, and an example of how you're going to conduct the test that's reproducible and measurable, okay? And then at the end of that, I will have a presentation, and I'm keeping the money if it works out and McDonald's gives $1 million for this peanut butter and jelly sandwich. So are you ready, proctors? You ready? Go get them. 10 minutes. This is not a rest home, so we stop in 10 minutes. All right, remember we need a research plan. We need independent and dependent variables. And that'll be enough. And then how you're going to do it, what you're going to test it on. And I want the test to be measurable, not just yum yum. The question, remember, is the best peanut butter and jelly sandwich. Expense is not an issue. Okay. Time. So we're going to start with the peanut butter people. So, Nancy, do you have the peanut butter presenter all named? Is he or she ready to go? Come down here and give your presentation. Now remember, we need what your plan is, independent and dependent variables, and how you're going to measure how much I like your peanut butter choice. All right, let's go. You're too slow. All right, there's a volunteer. Right down here. I like it when the women lead. This is important.
Thank you. Okay, so we broke down our peanut butter problem into the smaller problem of crunchy peanut butter versus smooth peanut butter. And our hypothesis was that smooth peanut butter would make the superior peanut butter and jelly sandwich, with the null hypothesis being that there would be no difference between having crunchy peanut butter or smooth peanut butter in the sandwich. So to test this, we would give our test group one sandwich with crunchy, and one sandwich was smooth. And then have a rating scale of 1 to 10 where they rate their preference of each sandwich. Collect those numbers and then see who likes what better. What is the most popular kind of peanut butter in the peanut butter and jelly sandwich?
Okay, great job. Everybody applause. Notice how nicely she pulled a Roscoe. She picked a little part. She didn't try to do the whole thing. She didn't try to do cashew butter versus pecan butter or anything else. She picked it into a nice little thing. Can anybody think of a variable that she didn't mention? She just did a straight peanut butter test. Anybody?
Natural versus present.
Right, okay. Age would make a difference maybe in that and all, but that's okay. I'm not criticizing. That was a good job on the test. So now the jelly group. All right, where's the jelly group? They're in the back. Jelly group, send me a volunteer from the jelly group. Otherwise, I'll pick one. I see a woman in the back laughing who wants the leadership role. No, now I see a man getting the leadership. Who is doing this here? Who's running that group? Chase one of them down here. Get a cattle prod. Let's get this done. There he is. All right. All right. We need you down by the podium so we can applaud for you appropriately. Jelly, peanut butter, and jelly. You ever sing that? No? I can't sing, so there you are.
This one works?
This one works.
All right. We were the jelly group, and after a lot of deliberation, we came up with a study. We're going to look at some of the more popular, highest, top-selling jellies around the area. And from those, we're going to pick a bunch of jellies. We're going to test the jelly quality and favorability amongst school-aged children, who we figured would be the highest consumers of peanut butter and jelly sandwiches. We're going to take those jellies and take them out of their packaging. Okay. So we're going to take those jellies out of the packaging to kind of try to get rid of some of those variables. And put them in a bowl and do some simple taste testing with them. We're going to look for a type of favorability score that had been used either for jellies or jams in the past or other type of food sampling, something that had already been validated. We're going to have that satisfaction score, give it to all the people who were sampling our jellies, and then based off of those scores, determine the most favorable jelly.
Thank you, sir. Very good. Okay, so notice what they did different than the peanut butter folks. Peanut butter folks, they kept it really concrete. They followed Roscoe right to the micron. You know, they were only doing two things. It's either going to be crunchy or it's going to be smooth, and you're going to like it. They didn't give any options, right? I like that approach, but they gave options. They gave options, and they were sort of more cross-sectional in what they would do. They did look for a previously validated system, and they defined a very nice age group. Now, McDonald's may not agree with that because kids don't have any money. They want grandparents to pay for the kids. But that was good. That was very good. All right, the bread group. All right. Oh, here comes a bread volunteer. All right.
For our group, we relied on dependent variables. They are taste, appearance, spread of the peanut butter, integrity, shelf life. For the independent variables, we found type of flour, baking condition, size of loaf, shape of loaf, fiber contents, if it is organic or not, the slices, how thick or thin they are, shape, baking condition. We decided to try these maybe on children or moms, snack them during like lunch, and see how the things are going.
Thank you. Very good. Very good. Okay, so they also took a more universal approach, right? But they didn't get into what grain they were using. You know, whether they were using oatmeal or, I don't know, frog blood or whatever for their bread. But they did a very nice overview. Notice how dependent, he mentioned it, how dependent they are on jelly. That jelly group, you can't let them down, all right? You got to make sure you're right. All right, the final piece de resistance for acceptance is the presentation. So we have our master of presentation here who will give us the presentation.
All right, so presentation, I feel like we got the easier one here. So what I'd want is to pick out, you want to get a group of children that represent the population of the United States as a whole. So you have like kind of a microcosm of that population that you're targeting. And you take these kids, and the independent variables are going to be the different presentation options. So what we decided to do was like circular versus a square sandwich, right? So that's just one, if you want to look at one individual variable that we can control. There's also a bunch of other things that we could look at, like whether it's in a box or whether it's in a wrap, how you present it. But you take one of those, you know, dichotomous kind of situations where you have a choice of one or the other. You have the children come into a room where they're presented with one or the other, and you simply let them choose which of the sandwiches they want. And you're able to, you know, tally up based on how many of those are taken, you know, which one was favored by the children. And this would give you your dependent variable, which is which one was selected more. And this will give you your answer of what will be the best presentation. So like we could say for ours is that the null hypothesis would be that children would go for the square sandwich because that's what they're used to. The hypothesis would be, you know, that people or the kids will prefer the round, you know, peanut butter and jelly sandwich instead. So and then you could take that with each of the different, you know, variables of presentation and make your decision based on that.
Thank you. Very good. So maybe the null hypothesis would be that they didn't give a damn whether they were square or round, right? And so that's the way they kind of set it up. There are all sorts of other things, like I had a grandson who would not eat a damn peanut butter and jelly sandwich unless it was sliced in triangles. None of this across stuff. Then I've heard from other people in the audience that they had children who wouldn't eat a peanut butter and jelly sandwich if you left the crust on. Then somebody else said the crust was the best part. So there's a lot there. And hopefully we had a little fun. Hopefully you remember a little bit about variables. And if you remember nothing else, remember pick the small parts, pick the project apart, and you become the person who knows the most in the world about your little corner of the world. That's the way you build success. So thank you all for participating. Have a good evening. The bar is open. Bye-bye.